It's been 57 years since the first contract between residents in the city of New York in 1957, and since then we've grown to include chapters in 5 other states plus DC, with a current body of 13,000 members.
This year's been the most successful organizing year since 2001. Over 800 residents have joined the CIR family, representing hospitals in California and New York. Not only has our organizing taken off, we've ramped up our quality improvement program, protected the safety net, settled strong contracts, and paved the way for new physician leaders for years to come.
It's clear from the work that took place this year that when physicians are united, much can be achieved. Residents are more like med students than hospital employees? We don't think so, and neither does the NRB. We were able to win recognition at Amherst Hospital in Queens, Dignity Health in Los Angeles, and 594 residents joined us from UC Irvine Medical Center in California. With the petition filed at Beth Israel in New York, we are continuing to grow even in the midst of a changing healthcare system. Not only are we growing, we're making big waves in the QI world. Across the country, members are jumping on the quality improvement bandwagon. In LA, residents held the first ever Southern California QI Summit last August, where they presented papers and applied for grants to fund project ideas. We launched the QI Gateway website to be an online clearinghouse for residents, and 500 users have already signed up. University of New Mexico residents published their second annual QI journal.
Resident-initiated adverse event reporting projects at Boston Medical Center and Cambridge Hospital have moved the needle on this critical patient safety issue, with reporting badges produced, reports up, and project posters accepted at several prestigious conferences.
We asked residents and faculty, what's your QI IQ, in a series of conferences at the New York Academy of Medicine.
Here's a quick roundup of contracts won around the country. Residents at Jackson Memorial Hospital in Florida negotiated a $125,000 house staff involvement fund. The CIR Bargaining Committee at Brookdale Hospital prioritized quality improvement as a way to collaborate with administration and improve the lives of patients in the community. After almost a year of negotiations and no movement, the resident physicians at Children's Hospital Oakland got a special delivery on Valentine's Day this year, but not from their secret admirers. They received hundreds of cards along with an oversized teddy bear card that read, "Please be fair to those who care," and bargain a fair contract. Love your patients, parents, and staff. Other contracts settled this year include DC Children's Hospital, San Francisco General Hospital, Santa Clara Valley Medical Center, St. Luke's Roosevelt, New York Methodist Hospital, LAC USC and Harbor UCLA, Kingsbrook Jewish Medical Center, Jamaica and Flushing Hospital, Jersey City Medical Center, the Institute for Family Health, Brooklyn Hospital, and Bergen Regional Medical Center.
We got political this year, making first ever endorsements in both the New York City and New York mayoral races in Bill de Blasio and Ross Perot respectively.
It's a city of 8.4 million people, and every one of them is depending on us as leaders to make sure that healthcare is readily available for them.
It's time for the rest of us to get on board and begin to target the violence in our community the same way we target diabetes, the same way we target polio, the same way we target typhus.
As frontline providers, we know how important it is for people to be able to take time off to recuperate or care for a loved one. And CIR leaders have been at the forefront of the paid sick leave movement.
It's about our children, our mothers, our fathers, parents, our community as a whole. Earned sick time makes sense.
CIR members couldn't wait to let their patients know about the Affordable Care Act. They were so excited, Dr. Say Solomon and Michelle Espinoza partnered with SCIU to get the word out.
We have some exciting news.
This is really fantastic.
Big things are happening.
On October 1st,
new lower-cost healthcare plans will become available on the health insurance marketplace, thanks to the Affordable Care Act.
In California, CIR doctors headed to Sacramento to support bills to expand Medi-Cal, California's Medicaid program. It's well documented that women in the workforce make less than men. Even today, female physicians make an average of $45,000 less per year than their male counterparts.
My first couple of rounds on the floor, I was being tested. Definitely I was hired at the same time as a male physician, and he definitely had an easier time.
We've held women in medicine conferences and dinners in New Mexico, Florida, California, Massachusetts, and New Jersey to help address challenges they face in their hospitals, bargain for their language and contracts that address their issues, and develop mentorship programs.
Forging a path for new physician leaders, CIR members have placed a renewed focus on women in medicine, physicians of color, and the importance of developing the leadership skills needed to be change agents in a changing system. At Rutgers University, New Jersey, high school students, many of whom come from neighborhoods where kids have been excluded from college and medical school due to their race or low income, were able to participate in mock medical scenarios, a hospital tour, and panel discussion with residents.
The Healthy Bronx Initiative's Family Health Challenge, an 8-week program in which residents partner with Bronx schools and community centers to promote nutrition and healthy lifestyles, received local media attention this year. The project was even accepted to the National ACGME Conference in Maryland. Of the 63 poster presentations, CIR was the only poster featuring a community-based program that addressed health disparities. The Terrorite Patient Safety Roundtable has inspired 3 years of house staff from around the country, solidifying a generation of empowered physicians. This year, 9 residents received scholarships to attend and learn from national leaders in the patient safety movement.
Where will CIR be 57 years from now? Organized doctors throughout the country? Quality healthcare available to everyone? A growing wealth of diversity in the physician population? We don't have to wait and see. We'll be the ones making it happen.
Harder, better, faster, stronger.